Friends, let me start by saying something that may sound exaggerated at first, but by the end of this conversation, you will understand exactly why it is not. There is one simple food sitting quietly in kitchens around the world that has the power to change how your blood flows, how your heart works, how your brain thinks, and how your body performs. At the same time, if the same food is used carelessly without understanding its nature, it can quietly damage the kidneys, dangerously lower blood pressure, and create long-term health problems that most people never connect back to what they are eating. That food is beetroot. Most people think of beetroot as just another vegetable, something you slice into a salad or throw into a juice without much thought. But beetroot is not ordinary. It is biologically active. It interacts deeply with your circulatory system, your nervous system, your digestive system, and even your hormones. That is why beetroot has earned the reputation of being a natural blood booster and performance enhancer. And that is also why it must be respected. When you eat beetroot, it does not behave like most vegetables that simply pass through the digestive tract, providing fiber and a few nutrients. Beetroot changes how your blood vessels function. It changes how oxygen moves through your body. It changes how efficiently your heart works. And it does all of this because of one key group of compounds that most people have never fully understood: natural nitrates. These nitrates are not the harmful artificial nitrates you hear about in processed foods. These are plant-based nitrates that your body converts into nitric oxide. Nitric oxide is one of the most important signaling molecules in the human body. It tells your blood vessels to relax. When blood vessels relax, they widen. When they widen, blood flows more freely. When blood flows more freely, every organ downstream benefits. This process begins quietly. After you eat beetroot, the nitrates are absorbed into your bloodstream. From there, they undergo a conversion process that ultimately produces nitric oxide. Once nitric oxide is available, it starts acting on the inner lining of your blood vessels known as the endothelium. The vessels soften, resistance decreases, and circulation improves. The heart is the first major organ to feel this change. When blood vessels are narrow and stiff, the heart must work harder to push blood through them. Over time, this strain contributes to high blood pressure and heart disease. When beetroot increases nitric oxide and improves vessel flexibility, the heart can pump more efficiently. Blood pressure often begins to come down naturally, not because the heart is weaker, but because the resistance it is pushing against has decreased. This is why beetroot has been studied extensively in relation to blood pressure control. In many people, regular but moderate beetroot intake leads to measurable reductions in systolic and diastolic blood pressure. This is not an instant drug-like effect. It is a gradual improvement in vascular function. And that distinction matters because long-term vascular health depends on flexibility, not force. Once circulation improves, the next major beneficiary is the brain. The brain is an oxygen-hungry organ. It consumes a disproportionate amount of your body's oxygen and nutrients. When blood flow to the brain improves, cognitive function improves, memory sharpens, focus becomes steadier, reaction time improves. Studies have shown that beetroot consumption increases blood flow to regions of the brain associated with decision-making and executive function. Over time, this improved perfusion may help slow age-related cognitive decline. This is one reason beetroot is increasingly discussed in the context of brain aging. Conditions like dementia and Alzheimer's disease are closely linked to impaired blood flow and vascular dysfunction in the brain. By supporting healthy circulation, beetroot may help reduce risk factors associated with these conditions. Again, this is not a cure. It is supportive nutrition that works over time. Muscles respond in a similar way. When blood flow increases, oxygen delivery to muscle tissue improves. Oxygen is the limiting factor during physical exertion. When muscles receive oxygen more efficiently, they fatigue more slowly. Recovery improves. Lactic acid buildup decreases. This is why athletes often use beetroot juice before training. It does not stimulate the nervous system like caffeine. It improves efficiency at the cellular level. This effect is not limited to professional athletes. Everyday activities become easier. Walking feels less tiring. Climbing stairs becomes less taxing. Endurance improves quietly. Many people notice that after consistent beetroot intake, they feel stronger without changing anything else. Now, let us talk about blood itself. Beetroot contains iron, folate, vitamin B6, and vitamin C. These nutrients work together to support red blood cell production. Red blood cells carry oxygen. When oxygen delivery improves, fatigue decreases, dizziness improves, cold hands and feet may become warmer. This is particularly relevant for individuals with borderline anemia or low iron stores. However, it is important to be clear here. Beetroot is not a replacement for medical treatment in cases of severe anemia. It is supportive nutrition. It helps the body do what it is already designed to do, but it cannot override serious deficiencies on its own. The digestive system also responds positively to beetroot when used correctly. Beetroot is rich in dietary fiber. Fiber stimulates bowel movement, supports gut bacteria, and helps prevent constipation. A clean, active gut improves nutrient absorption and reduces toxin buildup. This matters because gut health is closely linked to immune health. A significant portion of your immune system resides in your digestive tract. When digestion improves, immunity strengthens. Skin health is another area where beetroot's effects become visible. Improved circulation means better nutrient delivery to the skin. Waste products are cleared more efficiently. Over time, acne may reduce. Skin tone may become more even. A subtle glow often appears. This is not cosmetic magic. It is improved internal function showing externally. The liver also benefits from beetroot. Beetroot contains betalains, compounds known for their antioxidant and anti-inflammatory properties. These compounds support liver detoxification pathways. They help the liver process fats more efficiently and may reduce fat accumulation. This is particularly relevant in the context of MUSIC fatty liver disease, which is increasingly common. Beetroot also plays a role in metabolic health. It is low in calories but high in fiber. It promotes satiety, meaning you feel full sooner and stay full longer. This reduces overeating and supports gradual weight loss. Unlike crash diets, this approach works by supporting appetite regulation rather than fighting hunger. Hormonal balance is another often overlooked area. Improved circulation and nutrient delivery support the adrenal glands, which regulate stress hormones. Many people report improved sleep quality and reduced feelings of stress when beetroot is used appropriately. This may be partly due to improved blood flow and partly due to the presence of nutrients that support nervous system function. At this point, beetroot sounds almost too good to be true. And this is where we must slow down and talk about reality. Beetroot is powerful, and powerful foods require boundaries. The MUSIC most significant risk associated with excessive beetroot consumption is kidney stones. Beetroot is high in oxalates. Oxalates combined with calcium in the kidneys and form stones. People with a history of kidney stones or high oxalate levels should be extremely cautious. For these individuals, beetroot can do more harm than good. Blood pressure is another concern. Beetroot lowers blood pressure. For people with hypertension, this can be beneficial. For people with already low blood pressure, this can be dangerous. Dizziness, fainting, weakness, and even shock can occur if blood pressure drops too far. Beetroot does not discriminate. It improves circulation regardless of baseline levels. Betaia, the red or pink discoloration of urine or stool after eating beetroot is harmless, but it can be alarming if you are not expecting it. This reaction is more common in people with iron deficiency or faster digestion. It does not indicate internal bleeding. Beetroot also contains natural sugars. While they are not extreme, people with diabetes must be cautious. Excessive beetroot intake can cause blood sugar spikes. Moderation is essential. Digestive discomfort is another potential side effect. Gas, bloating, diarrhea, and stomach cramps can occur when beetroot is consumed in large amounts or when digestion is weak. So, how do you use beetroot safely? Timing matters, quantity matters, frequency matters. The ideal approach is not daily consumption. Beetroot is best used strategically. 2 days per week is sufficient for most people. On those days, a portion of 100 to 150 gram is enough to deliver benefits, without overwhelming the system. Light cooking is often better than raw consumption. Light boiling reduces oxalate load while preserving nitrates. Pairing beetroot with other vegetables like carrot, ginger, or amla improves balance and digestion. Morning consumption or pre-workout consumption is ideal. Avoid consuming beetroot late at night. There are clear situations where beetroot should be avoided entirely. Anyone with kidney stones, chronic kidney disease, consistently low blood pressure, or uncontrolled diabetes should not use beetroot without medical guidance. Beetroot is not a daily tonic. It is a functional food. Used wisely, it supports the body. Used carelessly, it stresses it. Understanding food is about understanding dosage, context, and individuality. No food is universally good or universally bad. Beetroot is a perfect example of this truth. When used correctly, beetroot improves circulation, enhances brain function, increases stamina, strengthens digestion, supports the liver, improves skin health, and boosts overall vitality. When misused, it can quietly create problems that appear unrelated until they are serious. Knowledge transforms food into medicine. Ignorance turns medicine into risk. I am Dr. Jocelyn Carter. My purpose is to help you understand how food interacts with your body so you can make informed decisions. Beetroot does not need hype. It needs respect. When you give it that, it can quietly support your health for years to come. Thank you for listening.